Has your child been to countless doctor's appointments, had multiple rounds of blood work, maybe even MRIs or other expensive tests, yet you still don't have real answers about what's causing their chronic health struggles? You're told everything looks normal on their labs, but your child is still dealing with sleep issues, digestive problems, behavioral challenges, or developmental delays. And meanwhile, your pediatrician keeps saying they'll grow out of it or offers another medication to manage the signs. But what if I told you there's a crucial exam that reveals the real root cause of your child's health challenges? One that most doctors never perform. An assessment that can detect the hidden dysfunction that traditional medicine completely misses. Yet it's completely safe and non invasive for your children as young as day one. This video is for exhausted parents who've tried everything from diet changes to supplements to medications and therapies, but still don't have real answers. They don't have answers about what's really causing their child's chronic health issues and are looking to look deeper. They're ready to look deeper than just the signs. We're diving into this revolutionary INSiGHT scanning technology that assesses your child's nervous system function, the air traffic control center of their entire body. You'll discover why this exam is more valuable than traditional blood work or imaging and how it reveals the true root cause of chronic illness that other approaches just miss completely. Now, here's a staggering reality that should concern every parent. Traditional medicine relies primarily on the signs and looks for obvious pathology on standard exams like blood work, MRIs, and EEGs. Yet these tests often come back normal even when children are clearly struggling with significant health challenges. What's missing from this approach is an assessment of the most critical system that determines whether your child is healthy or not, the central nervous system. Now, Dr. Bruce Lipton, a renowned cell biologist, puts it perfectly. He says that the function of the nervous system is to perceive the environment and coordinate the function of all other cells. This means while you've probably invested considerable time, energy, and resources trying to improve your child's gut health, their immune system, and motor development through various therapies, most healthcare providers have completely overlooked the one common thread that ties them all together, the nervous system itself. The central nervous system serves as air traffic control for your child's entire body, coordinating every internal function with every movement, thought, emotion, behavior, and cognitive process, making it the most important system to assess. While traditional medicine chases the signs and movement based therapies assess muscle tone, we go deeper. We as pediatric chiropractors evaluate nervous system function through this advanced scanning technology. Now, your child's brain doubles in size the first year of life, and it continues rapid development, making the nervous system assessment during this critical period far more important than knowing where they sit on a height and a weight chart. So, I want to walk you through these three scans and explain why they're so key to helping your child. The first scan is the neurothermal scan. It's a temperature scan, thermography, and it helps to identify what we call the regional effects of subluxation and dysautonomia, which can affect your child's digestive system, their immune function, their hormones, and their sleep regulation. These functions are supposed to run on autopilot. And this explains why conditions like colic, reflux, constipation, chronic ear infections, and allergies that traditional medicine cares for as a separate, unrelated issues. If the autonomic nervous system, you can think of it as the automatic side of the nervous system, if this is stuck, then we're going to struggle. Our kids will struggle with these more basic functions of life that are supposed to work well without any help. And that's what that thermal scan can help us to see. Now, the second scan we run is what we call the neurospinal EMG scan, which measures what we call the neuromotor system or movement system of the body. It's an energy scan. And this scan is vital for investigating conditions like autism, like sensory processing disorders, ADHD, and anxiety. It's a simple way, to put it simply, it's a way of how is the body communicating to the nervous system. We can see, we can detect three key patterns, one of which we call the raging bull, which is seen in hyperactive and anxious children. It's a child who's on and doesn't seem to turn off. They're go, go, go. And then the other pattern, we call it the drunken bull pattern, is when a child has coordination and focus challenges. Their sensory system isn't perceiving things as it could or should. And then the third pattern is a combination of the two. It's a raging drunken bull, which is both patterns put together. It's a kid who is uncoordinated and also will run through a wall because they're so wound up with this energy. And this scan shows us specifically how well the body is coordinating movement and energy and how it's perceiving its internal environment. Like we said, it's essentially how is the body communicating to the nervous system? Is it calming and sending good information? Or is it confusing and dysregulating and creating more stress on the inside? The third scan is the heart rate variability scan. This assesses your child's adaptability and resilience while revealing whether their nervous system is healthy and balanced or stuck in chronic stress mode. It's like measuring their body's battery or their ability to handle stress. It's a key marker that determines if they can properly adapt to daily physical, emotional, and environmental challenges. And so we want to see what a child's nervous system is like in our office in a calm and relaxed state. If it's not, and their system is more stressed, then this marker will tell us essentially, hey, we're probably going to struggle with some things. And that can look like a host of challenges, symptoms, and diagnoses because the nervous system at the root of those things is stressed from this global standpoint. Now, these scans explain a lot of what traditional medicine can't because they look deeper. They look at subluxation, they look at dysautonomia, the real root causes creating those major problems in your child's nervous system. When we look at the EMG scan, for instance, we can see stuck stress and tension, lack of balance and coordination, and overall disorganization and dysfunction, which can manifest as symptoms like a child with ADHD tendencies, like difficulty regulating emotions or calming down, like trouble sleeping. Lots and lots of things can show up when the nervous system is dysregulated. So these scans can reveal why children don't actually grow out of early problems like colic and tantrums, but instead grow into more serious conditions like the anxiety, the sensory processing, ADHD, and chronic illness as they continue to age. It's the same nervous system. If it's stuck and dysfunctional, it continues to grow and stuck in that state. Now, the INSiGHT scanning technology provides this precise measurement and tracking of nervous system dysfunction. And that's not just some label or diagnosis we're going to have to fear. How we approach it is that these scans are showing us that this is how an intelligent system is adapting. Based on its own experiences and how it's interpreting its world, we see that it isn't working as efficient and easy as it could or should. So when we see that, it's very clear how we need to tackle caring for that child. And this allows us to create personalized care plans that address the actual cause rather than just managing the signs with things like medications or endless therapies. We want to go deeper and address the root cause. And that's what the INSiGHT scans help us to do. They're so powerful as they aim to look deeper at the root cause of what the body is doing and why. And as you know, it is so important to look deeper, especially when other avenues haven't given the full answer. So if you want to learn more about these scans, click the link in our bio to dive even deeper into these scans. We would love to help you guys. When we can measure what truly matters, the nervous system, it can help you put the pieces together and help your child with their health. That's all for this video. Thanks for watching and have a wonderful day.